The biggest difficulty, I would say, of being a parent with a child of special needs is the constant worrying about everything, from if she's going to be crabby for school that day, if she had enough rest, when she's crying and can't communicate, she's nonverbal. She has little communication skills, and it's very hard. Even last night she was up crying for 2 hours and I didn't know what was wrong. And just worrying what's going to happen to her, when I'm not able to take care of her in the future. She's going to need constant care her whole life, and right now I have a very supportive family. When we're all gone, I worry if Anthony's going to have to take over and have that, kind of have that responsibility for the rest of his life to be her protector and take care of her, although he seems to enjoy it now.
I play with her and help her if she's crying.
If she's crying?
Mm-hmm.
Do you enjoy that?
Mm-hmm.
Do you have fun?
Mm-hmm. Yesterday, when she cries, I hold her hand.
You hold her hand? Oh, that's nice. You must love her a lot. Do you think that you and your sister love each other a lot because you're twins?
Yeah. If she's on the computer and she can't get and she's doing something, if she's touching glass, I get her away from there and bring it all to Mommy.
Kids pick on kids, even normal kids, and with her disabilities, I've started to hear now kids her age, at playgrounds and things like that, saying stuff, and I'm just afraid Anthony's gonna feel like he has to defend her. So next year they're going to separate schools, which I think might be for the best. They've been together all this time, so that would be good. Another hard thing about having a special needs child is you just feel guilt all the time for different things. I know whenever she does fall down, me and my husband will start arguing. You weren't watching her, or sometimes I'll even blame Anthony. If they were chasing each other through the house, and all of a sudden he was chasing her too quick and she falls down and hits her head on the wall, I'll say, Anthony, why were you chasing her, when he was just trying to have fun? So then you feel guilty afterwards for yelling at somebody when it's basically out of your control. And if Anthony fell, we wouldn't even think twice about it. It's just a normal kid falling, and it just happens. But with her, it's just more, you're always on kind of suspense, like gasping, and oh my God, is she gonna step over the curb okay, or should I let her try it herself, or is she gonna fall on her face? That kind of thing with limits. And I also feel guilty because I'll look at other kids, and compare her constantly, not just to the normal kids anymore, but the typical kids, but the special needs kids. And I say, if I see someone with special needs, and I say, okay, is she better off with the type of special needs she has, or is she worse off? And then I just feel guilty for even thinking that way, when I should just be enjoying every moment with my kids at this age. I feel like I should be happy. She is healthy besides the seizures. Everything works, and she seems to be happy for the most part, although when she was younger, she would just cry for hours on end, and we didn't really know what was wrong with her. But now she loves people. She's very loving. But again, I feel guilty for things that we can't do with Anthony. For example, we can't really go to movies because she would just walk around the whole time or scream. Amusement parks. I just don't want him to miss out on the fun things that he can do. And he's just very compassionate. He helps other kids. He's very, very social. He just goes up and makes friends with anybody because he had to kind of learn to do things on his own.
I'm getting off the highway.
You're getting off the highway? Where are you going to go?
Toys R Us to pick up a trailer.
That's why they pick up such heavy loads. You're going to get a big load of trucks? Toys?
Yeah. For kids.
For kids? What kids?
All the kids in the world.
All the kids in the world? So all those kids who don't have any toys are going to have toys?
Yep.
You want to give them toys?
Yeah. So I'm trying to do.
I know he's so good. He's such a good kid, and I know that's because of the situation he has. He's learned he has to be very patient because he always came second, which I feel guilty about, but he always, sometimes he'll verbalize and say, why is Ari always first? You always help Ari. It's because she can't do it herself. But he learned to sleep through the night at 2 months old with no problem because she was always up crying and I'd have to go calm her down. If we were at playgrounds, when they were younger, I'd have to follow her step by step or carry her around, and he had to go off. He'd go running on his own and find kids to play with. He'd learn how to go on slides himself, the swings, because I was always helping her all the time. I'm starting to finally, the past few months, realize they're two separate people. I mean, when you're expecting twins, you kind of have this vision in your mind, or even just a kid, when you're expecting a baby, you expect what you're going to be able to do with them, and then you don't get to pick how they're going to turn out and what the challenges are going to be. But every family has their own challenge at some point in life, whether they're kids 2 or 18, or but some are just more extensive than others, and you take it day by day. And I met a lot of friends, that have children with special needs through programs with her, and we stick together and help each other out for having a bad day. The hardest part is not really knowing her diagnosis still. This probably goes into another question, but they were full term at birth, and they weighed perfect. She was over 6 pounds, he was over 7 pounds. There was no NICU, nobody knew anything was different about her when she was born. And I took them home, and she just kept crying all the time, and then at 5 months she started having seizures. And that's when they said something was going to be wrong, but they're not sure what, although all the testing they do comes out normal. So the hardest part is not knowing which support group, like official support group, organized support group, to join, because she's gone from the diagnosis of autism, which clearly I don't feel she has. She's very social, and she does have the movement disorder as well, and the seizures, which now they're saying could be more like cerebral palsy because of all the combination of that. But just not knowing exactly what category she falls into, to do research on it or to make sure she's getting the right therapies. That's been the hardest part, is not having that name, that label to grasp onto. None of the doctors can tell me what exactly happened to her, and I just want to know. I want to know, was it something, in the womb? Did she have a seizure in the womb and lost oxygen? That's what happened? Or did something just not connect right in her brain? I just want an answer. Nobody can really give me that. Well, financially, we had to, I had to leave the job I was at full-time, and luckily I was able to find the part-time position here that I love.
Ice cream.
Yeah, sweetie. But that took a big cut financially, is going from full-time to part-time, and I basically had no choice, because I was taking her to doctors, every other day, and if she'd have a seizure, I'd have to bring her in for blood work and testing. Luckily, my insurance has been covering a lot of it, but there still is all the co-pays, and she does have about 7 or 8 doctors that she sees regularly. So even $20 co-pays, when you do that every month, and therapies and medication and regular physician, every time she cries, the school will call and say, we don't know if she has an earache, she touched her ear, so then I have to bring her in, since she can't talk, and see if she has an ear infection. So it's $20, $20, $20. Diapers, she's still in diapers. We're not sure if she'll potty train. She has been doing pretty well with it on and off. She's just not consistent. So hopefully she will. But just still buying, when your child's 4.5 and you're still trying to buy diapers for them, that's another expense you're not expecting when you are thinking about starting a family. It's funny, because a lot of people say, good thing this happened to you, which drives me crazy, but good thing this happened to you because you're so patient, and I am that kind of person. I do have a very high level of patience, and it makes me a better person too. My whole outlook of the world has changed since I had her. I know things that used to be important to me are no longer as important, such as for school. I know I'm a teacher, and I probably shouldn't say this, but I was straight A+ student, and I was expecting to raise my kids that they had to be the same, have an A in every class, all academics. And now I think about it, she may never be able to write her name. She may never be able to recognize her name. She still doesn't know who different people are. If you say, where's mommy, she doesn't know. I mean, she knows I'm her mother, but she doesn't recognize other objects. Even classmates, like where's, Kenny or where's Matthew. She won't know the difference if you ask who they are. So my expectations, I think I'm going to be a better mother for Anthony because I'm going to lay off a little more, and I just know that he's doing the best he can, and he's, even if he doesn't learn to read this year, he'll learn to read next year. I know I'm not going to need to push him and say, oh my God, if you don't read by first grade, you're not going to be in the top group. And I've learned to be more patient with that and just let them go at their own pace. We've met so many great people because of Ariana. And even last night, it's just amazing. We were eating at Subway, for example, and this woman just saw her walking, and Ariana is very friendly. She has that good quality about her. And she went up and pointed to the cookies at Subway, and the lady ended up buying us a dozen cookies and sitting there and talking to us. So there's people, something as simple gesture like that is really nice. Sometimes it's not knowing where to find the help. For example, with medical bills, I know that Anthem just stopped their agreement with CCMC, the Children's Hospital in Hartford, and that's where all her doctors are. So now I have to switch all doctors for her, find new ones, and tell her history all over with the doctors who have been working together to take care of her. And I know that there's money out there because I see every time I go to Walmart, for example, they'll say, would you like to donate $1 to CCMC? And I'm thinking, well, who gets that money? Could I use that money to keep her there with the doctors who know her well and know what's best for her? But I just don't know how to go about contacting the certain people or how she would qualify for that. But it's a full-time job with all of that kind of stuff. That's why the days that I'm off from work, that's why I'm doing phone calls and research. It's more stressful with her because what I would do on my days off if I was part-time and she was typical like Anthony, I'd be taking them out to parks or to, like I said, to the movies or playgrounds, which I still do some of, but I just think it would be more enjoyable to not have that stress over me, like I need to call this doctor today. There's just always something in the back of my mind that I need to do for her, especially, or therapists, rearrange therapists, and make sure she gets she has therapy appointments on her days off, so that takes up some of our free time that we could have been doing something more fun.
But it's still just as valuable as a parent.
Yeah.